even though you're taking the thyroid medication. Now, the key things with this is gonna be this. So, what are the thyroid symptoms to begin with? Well, fatigue, weight gain, brain fog, you're losing hair, or it's falling out, it's thinning, okay? Depression, anxiety, brittle nails, dry skin, those are all thyroid symptoms. So, what's happening with many of you is you have multiple things that are contributing to why you're having a hypothyroid. So, let me try to keep it really basic, and then we'll build the foundation here, and then going to expand to that. Okay. Shell and Gabby, you've got Hashimoto's. Okay. We've seen 9,000 people at this point with Hashimoto's disease. So, here's the thing, the first thing that you have if you're on the thyroid medication, and if you are on thyroid medication, give me a thumbs up or yes if you're taking that thyroid medication. And if you are, which one are you taking? Is it levothyroxine? Is it MP-thyroid? Is it Armor? Is it going to be Levoxyl? Maybe you've got a T3 like a cytomel or a liothyronine. Okay, drop in the comments if you're taking medication. Okay, here's what happens. This is why you're still having symptoms. So first off, you have these symptoms. You go to your doctor because you don't think something's right, and you go to your doctor, and the doctor is, "Well, let's screen you for a thyroid problem," right? Because these are thyroid symptoms. And typically what you're gonna get is you're gonna get maybe these 2 markers. You'll get a TSH and a free T4, okay? If TSH is high and free T4 is low, they will diagnose you with hypothyroid, and then they'll prescribe you levothyroxine. This sound familiar? Levothyroxine or Synthroid in Shell and Gabby's case. Okay? You're given levothyroxine. Now, then they say, "Okay, let's recheck you in 6 weeks." You go back in 6 weeks, and now your TSH and T4 are now normal, okay? So that normalizes TSH and T4. Free T4 is now normal, but you're still having all of these symptoms. And you tell your doctor, he goes, "Hey, look, I know our labs are normal, but I'm still having all these symptoms." And what does your doctor respond with? "Well, it's all in your head," or, "Hey, we'll just watch it. It takes some time," right? And so you give it time. You take the medication, everything is good. Your labs, TSH and T4, and here in a minute, I'm gonna tell you why those are just not enough for you to know what's really going on with your thyroid, okay? But you're still having all these symptoms. Well, here's the thing, when you're taking levothyroxine or MP-thyroid, any thyroid medication for that matter, okay, what it's doing is you're replacing the hormone that your thyroid cannot make, right? So imagine it's like this. If this is the amount of thyroid hormone that you should make every single day, and your thyroid is only kicking out this much, this is when you could become hypothyroid. And the levothyroxine is only right? It's only replacing that amount that your thyroid cannot make. It's only replacing, it's not fixing. So when you're taking your levothyroxine, and I have to tell this to everybody because they think in their mind that it's fixing stuff. It isn't. It's replacing hormone. It's no different if you're to take estrogen replacement or progesterone replacement, which we do some of these in our clinic. And is it doing anything for your ovaries? No. Is levothyroxine doing anything for your thyroid? No. Okay. It's just replacing the hormone. Now, for some of you, you take the medication, it does take your symptoms away. Those go completely away. Okay. And you're one of the lucky ones. And if that is you, then great. You're probably not watching this video, right? This live. Then you feel great. You take the medication. You're like, I don't want to take the medication, but it makes me feel amazing. So I take it, right? That's all that they have to do. But that's only 5, maybe 10% of people. 90% of you that are taking the thyroid medication or have been diagnosed with a hypothyroid, that doesn't happen and typically won't happen. So if your goal of one of the goals of you getting screened for these symptoms and you want these symptoms to go away and you're on the medication, well, the medication's going to do what it's going to do now. There is nothing more in that regard. Okay. But if you want those symptoms to go away, you have to look deeper. Okay. This is how I like to explain it. It's like you're going out to your car and you try to start your car and it doesn't start. But you happen to see that the gas tank is low. And you're like, "Oh, okay, great. We can do this. Let's go ahead and just add gas to the car." That's the problem. Let's add gas to your thyroid, which is levothyroxine, right? So you add gas to the car, you go back and turn it on thinking it's gonna turn on, it doesn't turn on, right? This is you, right? You don't turn on. You're tired, you're fatigued, you're pushing through the day, you're just struggling, right? And it doesn't turn on. And you're like, "I don't get it. I filled my gas tank up." And then is this how you would respond in that situation? Would you go, "Man, you know what? There's just nothing I can do. Like, my gas is full now, and it is what it is now." Right? And then, like, your friend comes over, like, "What's going on?" Like, "My car won't start, but it was out of gas, and I added gas to it, and it still doesn't start. So my car's totally broken. I'm done with this car. It's just I'm stuck with it." And your friend's like, "Well, wait a minute. What do you mean? That's just gas is full. That's only one thing. Did you pop the hood? Is your battery running good? Maybe you've got electrical problems. What if you got a carburetor issue or maybe a starter? Pop that hood. Let's look under the hood." Right? But that's the problem, is the conventional way of treating hypothyroid is only one thing, filling the gas tank up. That's it, with the levothyroxine. That is the standard of care. So if you feel like you're getting pushback from your primary care, your endocrinologist, just keep in mind they're following guidelines. This is one part of the process, but it's only one of about 20 different pieces of the puzzle that need to be solved. Okay. So we will look under the hood and go, okay, well, you have your TSH and T3, I mean your TSH and free T4 are normal now. What else is going on? Now that brings me to the second thing. You have number one, hypothyroid. The second thing that you have for over 90% of you, you have this. It is called Hashimoto's. You have Hashimoto's disease. What is Hashimoto's disease? It is an autoimmune condition. It attacks your thyroid tissue. In fact, it attacks the cells that make thyroid hormone. How do you know if you have Hashimoto's disease? You have a positive TPO antibody and a thyroglobulin antibody. Both of those will be high. That's how you know. But the problem is when you first went and got your thyroid checked, right? What are they pulling? They're only pulling these 2 typically. Why aren't they pulling these 2? You think because Hashimoto's 90% of the time causes hypothyroid. That's literally almost everybody, right? So you're like, "Well, gosh, why won't they check these?" There's one reason why they won't check it, and this is my whole point of telling you about these 2 processes that are happening. Because conventional medicine treats hypothyroid. They do not treat Hashimoto's disease. That is why they typically don't check you for it. This is also why if you have hypothyroid and you beg your doctor to check your antibodies and they finally pull the antibodies, has this happened to any of you? You begged your doctor, you had hypothyroid, and then they check your antibodies and they come up positive? You're like, "I knew it. I knew I had Hashimoto's disease." And you're like, okay, you're all excited to go to your appointment. Like, okay, what are we gonna do now? Now I know I have Hashimoto's, that's causing now we know the cause. That's causing the hypothyroid. Okay, so what are we gonna do? What's the response for those of you that that's happened with? How did your treatment change from regular hypothyroid to Hashimoto's disease? How did the treatment change? Anyone tell me in the comments. Did your treatment change at all? Okay. What I will tell you is no. Okay. You'll see here. No, there is no change. The reason why there's no change is because they're treating the hypothyroid part, but there isn't a drug for Hashimoto's disease. That's why. The drugs and the biologics that they use for autoimmune conditions, the side effects of those are so bad, it's not worth doing with Hashimoto's disease. Okay. This is why there's no change because they're not going to treat it. This is why, conventionally speaking, you're not going to get a TPO or thyroglobulin test because why test something? Why spend money on something that it's not going to change your treatment? That's why. And again, this is why if you watch like my live, you watch this and you're like, "Oh my gosh, I wanna see if I have Hashimoto's disease," or you see about all the other lab tests you'll need, and you try to go to the conventional medicine route, and they push back on you. Well, you don't need these. There's nothing you can do about it, because they're only treating this. Once you understand this one concept, you have a hypothyroid that conventional medicine is treating. But for 90% of you, you also have Hashimoto disease that they're not treating you for it. This is happening, but they're not addressing the reason why you developed this. Okay. Now, does that make sense? So for some of you, you're like, man, I'm just not happy where I'm at. They're not listening to me. I go in and tell them about all my symptoms over here, and they just kind of tell me it's all in my head, or they try to give me an antidepressant, right? Or they won't pull the labs that I need. I keep bringing up ferritin, like I saw some in the labs bring up ferritin. We'll talk about that, right? This is why, because they don't treat Hashimoto's disease. This is the main reason. So this is why trying to find a different endocrinologist or a different primary care, you're like, I'm going to find a doctor that does do this. And you're going the conventional route, you're going to be disappointed every single time. Many of our clients, the biggest disappointment appointment that they have is going to that endocrinologist. Okay. Because the treatment from your primary care to endo really isn't that much different when it comes to Hashimoto's disease, because it's all this. That is the only treatment. That's it, nothing else. So once you have this, the conventional route is done. Literally, they got their hand up here saying, like, well, stop right there. I've already prescribed you that. We're done with it. There's nothing else for us to help you with. Now, please understand, this is not the end of the road for you. Just because conventional medicine is only going to give you thyroid medication, and it doesn't mean you don't need it. But what it means is you have to pop the hood. You have to look under the hood. What else is going on? Why is your immune system attacking your thyroid? So you are going to have to look outside of your insurance, your conventional medical model box. Okay. And this is where I've come in. I've helped over 9,000 clients over 25 years. In fact, my wife was just like you guys. And really, this is why I do these kind of cases now, because my wife was you, okay? My wife was literally struggling. She was sleeping all day long. Literally, I'd come home at 6:30 at night, and she'd wake up at 6 and pretend like she was up all day. And so what was happening with her is over time, it just got worse and worse, and she finally came to me. She's like, "We need to figure something out." So what did we do? We went the conventional route too. We're like, "Okay, well, let's go get things checked." And we're checking everything, and the response we were getting from the multiple of doctors we went through was, "You need this prescription drug, you need this, uh, you need surgery." She had 18 cysts on her ovaries. That was one of the many things that she had going on. And my wife finally one night leaned over to me and she goes, "This is crazy. She goes, I'm going to all these doctors, and all they wanna do is just give me some kind of medication that gives me this big Band-Aid. It's like covering up what really is going on with me." And she's like, "I got 4 kids. I want to be like, I'm not gonna be any better in 5 years. I just wanna know why this is happening, and so we can fix it." And that is where my practice really changed. I was a pain management model. I flew all over the world. I spent $200,000 trying to figure out my wife's condition. We figured it out. This is why I do what I do now, is mainly because of my wife. I'm a certified functional medicine practitioner. I'm a licensed naturopath in Idaho, and I was not I did not find functional medicine. My wife's condition led me there. That is what we helped solve her problems. I still remember the day she got her life back. Now listen, if this is you and you're struggling and you're looking for solutions that actually will work for you, okay, there's 2 ways you can take the next step with me. One is you can go to my link in my bio, and on TikTok, if you're on, YouTube, you can go, the same place on YouTube. There'll be a link in the show notes. Um, do a free discovery call, okay? You can call, it doesn't cost you anything to talk to us. Number 2 is there's a root cause consultation where we can get down to the root cause, and that'll include a consultation with me. Plus, we send you a blood lab order. Okay, you'll get another blood test, and that's $199 to do all of it, including the testing. And you're getting like $3,500 worth of blood testing for $199. Okay, those are 2 ways if you're really struggling, but only do those if you're really looking to make some change in your life. Okay, so you have these 2 things going on, right? Now, I will tell you, okay, how many in here actually have Hashimoto's disease, okay? Put in the comments a thumbs up, "Yes, that's me," if you have Hashimoto's disease and you're also taking the thyroid medication, okay? Yeah, there's gonna be a lot of you. Okay, great. Now listen, I've seen 9,000 clients up to this point. Here's the deal. You don't just have Hashimoto's disease. You know how I sat here and told you about hypothyroid and 90% of the time it's caused by Hashimoto's? Yes. So this is causing that. But what you have to figure out with Hashimoto's disease, what is triggering the Hashimoto's to attack the thyroid? And now you're gonna have probably 8, maybe 10 triggers that's triggering that Hashimoto's disease. In the 9,000 clients that I've worked with, close to 10,000 now, um, it is so rare that someone comes in and all they have is Hashimoto's, and that is it and nothing else. I'm gonna walk you through the 6 patterns that cause you to have thyroid symptoms and how Hashimoto's is one of the 6, but most of my clients have 3 out of the 6. And out of those 6 patterns that give you thyroid symptoms, the medication itself only takes away 1 of those 6, okay? So we're gonna walk you through that, all right? So just keep in mind you don't have just Hashimoto's disease, okay? So yeah, so Nurse JJ is asking, "What's triggering the Hashimoto's?" That is the question you should be asking is this: "Why?" That is the question. Why are you having these symptoms? Why do you have a hypothyroid? Why do you have Hashimoto's disease? Okay? There are a lot of common triggers when it comes to Hashimoto's. In fact, let's talk about the triggers right now, okay? Um, let's talk about the triggers, and then we'll talk let me talk about this, okay? The 6 patterns that cause your thyroid to malfunction. Give me a thumbs up if you wanna hear right now about the 6 patterns that cause the thyroid to malfunction, and then we'll talk about the specific triggers because these are part of the triggers when it comes to your Hashimoto's disease, okay? Everyone's saying yes. All right, let's go through it. So the 6 patterns, 6 patterns. All right, number 1 is called primary hypothyroid. Now, primary hypothyroid is this, is your thyroid just isn't producing enough thyroid hormone, okay? And that's it. There's nothing else wrong. It's just a low functioning thyroid for whatever reason, okay? But it just isn't functioning. Now, if you're primary hypothyroid, how you know if you're only primary hypothyroid is you take the medication, all of your symptoms go away. That's how you know if you're primary hypothyroid. So, actually, not only is the, levothyroxine or the Synthroid or whatever thyroid medication that you're taking, not only is it going to help treat your primary hypothyroid, but it's also diagnostic. So, if you take if you're hypothyroid, you take all the thyroid medication and all of your symptoms go away, there's nothing else for you to do. You don't need me, you don't need functional medicine, you just need to live a good, healthy lifestyle, eat right, stay moving, exercise, and that's all you gotta do. You don't need me, you don't need my program, you don't need any of that. But unfortunately, that's only like 10% of people. That's the problem, okay? That's the problem. Next thing, number 2, if you're under converting T4 into T3, okay? So this is important. If you don't already know this, you have your thyroid gland here, right? It's a butterfly-shaped gland, and your thyroid produces 2 hormones, T4 and T3, okay? T4 and T3. Now, your brain, okay, is going to tell your thyroid what to do with TSH, okay? TSH is gonna tell your thyroid to make thyroid hormone, these 2 things, right? Now, this is the active hormone. This is the important thing. T3 is the active hormone. If you wanna know what lab test that really correlates to how you are feeling right now, that is going to be free T3 because this hormone is the one that actually goes to your cell and turns your cell on. That's why. So if you have T4 by itself doesn't indicate how you feel. It's the T3. But unfortunately, If you're gonna get a conventional workup, you're only gonna get a TSH and a free T4. This is your active hormone, okay? But this is only 20%. So only 20% of the hormone that comes from your thyroid is this active, ready to go hormone. 80% is T4, which is inactive. So you see the problem, right? The majority of the hormone that your body is actually utilizing to turn your cells on, because if you wanna have energy, folks, you gotta get that cell turned on, okay? Because the brain's coordinating all this, and it's using hormones to send the message. That's all hormones are, people. That's all it is. The brain goes, "Hey, I need to get these cells over here to do something in the thyroid, so I'm gonna use this hormone to tell the thyroid to do it." These hormones come out, and these hormones will tell your cell what to do. This is why every single cell in your body has a thyroid hormone receptor, every single one of them. This is why the symptoms are so vast. We had someone in the comments, "Well, why do I have weight gain and have a hypothyroid?" Because your cell isn't getting turned on. How do you get metabolism? Because of the cells, the mitochondria, right? All of these things have to be done. T4 does not do any of this turning on. That is T3. This is what T3 hormone is, one that can tell you how you are feeling. So I have patients that come into us. They have normal T4. Their T4 is great. In fact, I've seen they have too much T4. And they're like, "Doc, I'm so tired. I'm so fatigued. I can't even open my eyes. I can't even get out of bed." She goes, "But my T4 is good and my TSH is good." Because they're not looking at this guy. I'm like, "Well, what's your free T3 like?" "Oh, they never pulled it." "Oh, well, why not?" Because they don't need it to prescribe the medication, because they're measuring your blood thyroid hormone, which is the inactive one, okay? So T4 won't turn your cell on, it has to be T3. So here's the point, your body has to convert 4 to 3. For the majority of the T3, that's gonna turn your cells on. This conversion process does not happen in your thyroid gland, okay? Your doctors are looking here, everyone's looking there. I'm telling you, your problem isn't here. Hypothyroid is not a thyroid problem, it's a Hashimoto's problem. So here's the deal, when I go to number 2 patterns for thyroid, let me put thyroid under here so you kinda know. You're underconverting T4 to T3. Well, where does this conversion takes place, okay? If anyone's watching this, do you know where you're converting the majority of your body's ability to convert this inactive T4 hormone into the T3 hormone? Put in the comments if you have an idea where you think that is, okay? Well, this is what happens, okay? Tallow, liver, Lacey saying gut, pituitary, very, very small amount of the pituitary, not really, no, okay? Liver, gut, okay. Let me walk you through it 2 seconds. Here's how it's gonna go. T4 goes to your liver. That's the first stop, okay? And that's where 60% of the T3 comes from. And then actually, gut, gut and liver. Gut does about 20% of the conversion of 4 into 3. So where are we getting your active hormone that's turning your cells on so you can actually play with your kids, so you can play with your grandkids, so you can have energy, so you can do what you want to do in life? Well, it's coming from 3 places. Number 1, your thyroid gland, but not a lot, 20%. You're getting it from liver conversion, okay, and gut conversion. Those are the 3 spots. So here's the question, folks. Let's say you have a gut problem. Give me a thumbs up or a yes if you're having a gut problem in the comments. I guarantee you, I'm gonna get a list of people saying they have gut problems, because it is very rare that I have a thyroid patient that does not have a gut issue, okay? And many of you don't know you have a gut problem, okay? Couple of the symptoms of a gut issue: bloating, constipated, that's a gut issue. Bloating, diarrhea, gut issue. Acid reflux, gut issue, okay? Um, yeah, so these are all gut problems. And if you have a gut problem, here's my question. So a lot of you that put the thumbs up here, you have a gut problem. So let's say the gut problem, for this conversion to take place in your gut, you have to have a healthy gut. If you have inflammation in the gut, this reduces. So you have a gut problem. So let's say now you don't get this 20% conversion. So you lose 20% of the active hormone that should be turning your cells on. Do you think that that could give you all of these thyroid symptoms up here? Give me a thumbs up or a thumbs down. Is it possible? If you lost 20% of your income, would that make it difficult for you to pay some bills? Right? Yes. If your body loses 20% of your hormone, yeah, you're gonna struggle. Definitely struggle. Okay, now that's a gut problem, right? Is it the thyroid that was giving you a gut issue? Or giving you thyroid symptoms? No, it was a gut problem that made you not convert it, so you can't get to the cells that gave you these symptoms. This is the number 2 thing that happens here, okay? But what's happening? The only thing that majority of people, when they're getting treated for a hypothyroid, is getting the levothyroxine. They're treating everyone like they're number 1, and it's not a number 1. You have enough T4. T4 is fine, the body can't convert it. You know, it's kinda like you have these big barrels of crude oil in your house, in your garage, and you're like, "I need gasoline in my car." You have all this crude oil, and you're trying to get the crude oil into your car, it doesn't work. It has to be refined into gasoline. That's what your body has to do. So, gut issues can give you all of these symptoms. It has nothing to do with your thyroid. This is why many of you are still having thyroid symptoms even though you're taking the medication, because the medication is only addressing what? This. This one step, and that's it, okay? So you're underconverting T4 into T3, okay? Now, there's multiple reasons. I talked about one reason, could be gut. Now, the reason could be liver. Maybe you have a fatty liver. Maybe you have insulin resistance that's giving you a fatty liver. Okay, maybe someone brought up selenium. Yes, actually, the enzymes that are doing the conversion require selenium. They're selenium dependent. Absolutely, selenium dependent. Okay, zinc dependent. You need iron, you need oxygen for these enzymes to do the conversion. So some of you may have these deficiencies, but I'll be real with you, okay? Taking selenium, going gluten-free by itself will help you, but it won't put your Hashimoto's typically into remission because I bet a lot of you are already taking your 200 micrograms of selenium every single day, and you're still having symptoms because you're all different. That is why, okay? But yes, a selenium deficiency, I'll talk about nutrients here in a second. Selenium deficiencies can cause this conversion problem, which is number 2, right? Adrenal, okay? Cortisol hormone, that's the stress hormone, can prevent T4 being converted into T3. So that's an adrenal problem that's giving you thyroid symptoms. It is not a thyroid problem. Does that make sense? So even when we're looking at all of this, what you hopefully a lot of you just don't know where to look for, don't know what to do, but that's why people basically hire me to help them through that process. I work with them because we know what to do. We've seen 9,000 clients. We know the direction. We've been to the promised land before. I know the map. I know where to go. But yes, if you have an adrenal problem, okay, you always have to ask this question again. Why? If your adrenal is producing too much cortisol, that means you're in a fight or flight. Why is that? Is it because you have SIBO, a small intestinal overgrowth in your gut that's stressing your body out, that's causing you let's say you have an adrenal right here. Let me walk you through. Here's what can happen. One of the things that we see in SIBO, I mean, in gut issues is SIBO, small intestinal bacterial overgrowth, and that can give you, diarrhea, constipation, bloating, all of that. You're bloating after meals and stuff like that, you probably have SIBO, okay? But okay, it's an overgrowth. It's like an infection. Okay, well, why? Why do I have SIBO? Well, some of you, it's because you have low stomach acid. Okay, maybe you have low stomach acid. Maybe because you have a H. pylori infection. Okay, but you have to. So let's say you have SIBO, you have low stomach acid. Okay, if you have low stomach acid, for those that are taking B12, good luck absorbing any of that. For those that are taking iron, good luck absorbing iron if you have low stomach acid. Okay, I have a video I did. I think it's been seen by 3 million people now or something like that. on how to test it. Go through my videos and look at it. Okay. The low stomach acid can help you develop SIBO. And the SIBO is stressful to your body. So now it gives you an adrenal. When the adrenals get stressed, produce cortisol. Cortisol will prevent T3 being converted into T4. That means your cells don't get the hormone, and then you get the symptoms. Look how far back you have to peel the onion, right? All right. Next thing, number 3 out of the 6. There's 6 of these. This is number 3. Number 3 is going to be you're over converting T4 into what they call reverse T3. Reverse T3. Okay, remember at the liver, you had your liver here that your T4 is being sent to. Now, the way your T4 gets sent to your liver is by this thing called the thyroid binding globulin truck. T4 gets a ride on the truck from the thyroid. Okay, that's how it works. Your thyroid makes T4, gets sent over to the liver, and it has to be converted. Okay. And actually, 60% of T4 get turned into T3. That's what you want, right? But you have 20% of that T4 that gets turned into reverse T3. Okay. Reverse T3 is the brakes to your thyroid function. TSH, T3 is the accelerator to thyroid. Reverse T3 is the brakes. It's the one that's going to pull the reins back on your thyroid. What happens with some of you is you're over converting T4 into reverse T3. Now you don't have enough T3 left over. And again, how do you know if you're over converting into reverse T3? Well, you need to pull on your lab test, reverse T3. That is why you also need to pull free T3 on your lab test too to see if you're converting 4 to 3. You see why those are important now. Now, do you need any of those markers to be able to determine or manage your thyroid medication? No. So if you ask your doctor, can I pull a reverse T3 or free T3? And they say, we don't need that. Translation, I don't need that to regulate your thyroid medication. I got 50 other people behind me. That's all I can do for you. Bye. Sound familiar? That's what it is. Okay. So you're over converting T4 into T3. What can cause that? Again, those enzymes can be converted. Now, let's say you have a low ferritin. Well, these enzymes here require iron. Okay, require iron. And so what will happen is if you don't have enough iron, you don't have enough oxygen, you're not going to get that conversion to take place. That's why some people have anemia and they're having conversion problems that develop that the cell doesn't get the hormone, and then they get the symptoms, and then they are told that they have thyroid problems, which they really don't. Okay, what they have is a problem there. Okay. All right, number 4. Oh, I shouldn't have erased that. Let's go to number 4 here. Number 4 is you have thyroid binding globulins. These are trucks that it's a delivery problem. So again, you have this truck. My artistry is great. This is called a TBG that takes T4 and delivers it. T4 delivers it to your liver, delivers it to your gut, delivers it to your cells, right? Delivers it to your pancreas. You know what I'm saying? This is a delivery truck for your thyroid hormone. Well, some of you, this is the problem. Thyroid binding globulins. Estrogen dominance are big time with TBG problems. So now you have an estrogen dominance problem, okay, that's causing you truck problems, but no one's checking it. How do you know if you have these truck problems? Well, you don't pull TBG actually. You pull a T3 uptake test. Okay. If T3 uptake is high, you have low TBG. If T3 uptake is low, you have high TBGs. Okay. And the more TBGs you have in your bloodstream, that means more of the hormone is bound to it that can't get to your cell to turn the cells on. Okay. Okay. We're almost done here, guys. So again, we're already going through a lot of these here with you. Number 5, okay, it's going to be a hypothalamus and a pituitary problem. It's like the bosses aren't communicating properly. One thing I see with that is MTHFR gene problems. It's a gene mutation, so a lot of times we're pulling a DNA test to see if you got this gene, but that's only one of 40 that you really need to look at, okay? Genes. Some of you may have heard of this, okay? Some of you may have heard of it. So yeah, hypo, it's a brain problem. It could be because MTHFR, if you have depression, anxiety, this is probably part of the problem too. All right, number 6. Who can tell me what number 6 is? You all know Hashimoto's disease. Hashimoto's autoimmune condition. Okay. Your immune system is attacking your thyroid gland, causing hypothyroid, hence giving you the symptoms. Okay. Symptoms are fine and all, but they're just labels on what's going on. Okay. How many of you have Hashimoto's disease that have a hypothyroid? We just talked about it. 90%. 90% of people have Hashimoto's disease. Now, I said earlier, you don't have just Hashimoto's disease. Here's what you typically will have. Okay. Most of the clients I see, here's an average presentation. They come into us, they have Hashimoto's disease. They also are under converting T4 to T3, and they have truck problems. Those are the 3 things, right? And now you can break down, okay, well, what are the 3 things? Why did they have those 3 things? Hopefully, you're thinking that right now. Well, okay, well, let's look. Under converting T3, we already talked about it. Could be liver, right? Fatty liver, like non-alcoholic fatty liver. Okay, you could have adrenal, you could cortisol, you could have nutrients like low zinc, selenium, right? And that's just for that one. Look at how many different conditions are in there. Okay, TBGs, high estrogen, uh, any hormone imbalances, okay, can cause some of these things. Well, why do you get high estrogen? Well, maybe it's plastics, maybe it's your makeup, maybe it's your makeup. Okay, there's a lot of different things that contribute to that. And then Hashimoto's disease. Well, why do you have Hashimoto's disease? Well, gosh, you could have food sensitivities. You could have anemias. That could also be adrenal. You could have mold, toxins, just to name a few, right? Gut issues. Can't forget gut. That's like number one. Gut issues. Why do you have gut issues? Well, you could have SIBO. You could have IMO. You could have H. pylori. You could have leaky gut. Right? Oh, but why do you have that? Oh, well, okay. Look, I got to move it over. Okay, SIBO. Maybe you have low stomach acid. Maybe you have IMO. You've got low pancreatic function. Okay. You see how you have to keep moving it back. This is how you actually solve your problem, is knowing where to go with all of this. Okay. This is the key. The, the results are there. You can get your life back, definitely. But if your plan is to only take levothyroxine, well, you're missing all of these. Levo's only going to address this one. That's the only one. This one, Levo, Armor, NP, okay? Those are the ones you have all this to look at. So if you're still having symptoms, ask yourself, have I had that looked at? Have you had someone look under the hood? Car's not starting, you have full gas, but there's something else going on. That's what really needs to take place. Okay. Okay. All right. With that said, let's go to some comments. All right. We have a question here, Heather. If you're watching this, you want to do a consultation with us, you can send us a DM, or the easiest way I'll tell you is to go to my TikTok link. Okay. Some of you on YouTube also, you can go to my TikTok. It's in the program notes. But if you're on TikTok, you can click the picture here, and then another box comes up and another picture there. And then you'll find yourself at my bio, and there's a link. Click on that. That'll take you over where you can do, number one, a discovery call. Talk for a few minutes. Make sure you're in the right place. Or if you're ready to do tests, you're like, I'm ready to go. I need to get this thing handled. And you're ready to do testing, then you can do a root cause consultation. It's $199. You get the lab test that we include, which is about $3,000 worth of testing. Okay. And also, it's gonna include an hour-long Zoom consultation to me, so you don't have to come see me. We do everything remotely, virtually, okay? We do virtual visits. Again, we've seen over 9,000 people. So reach out to someone that knows what you're doing. If some of this is new, then I can guarantee you that that's why you're still having problems, is you're just kinda looking at the surface. You're only getting number 1 looked at instead of 2, 3, 4, 5, 6, and there's really 24 of them. I just don't have time to go through every single one of them. These are the big guys, okay? Um, and that's how you're gonna do that. So if you wanna reach out to us, that's how you can do it. You send us a DM, you can. My staff will probably get back with you on Monday, but just go to hit the link because you get to schedule your own time and all that stuff, okay? All right. We'll go through some questions. If you have any comments, I know a lot of you have left comments. Go ahead and drop them down again. Let's look at a couple of these, and then I'm gonna talk about some of the nutrients that you're gonna need to make sure are topped off, that can help you in the short term, okay? Let's go through some of these comments. So Diamond says you have SIBO. Yeah, SIBO is probably one of the biggest things that we see is SIBO. Yeah, we see a lot of those, okay? SIBO is a big deal, all right? If you have SIBO, yeah, you definitely need to get a SIBO breath test. And so how you know that is number 1, bloating and constipated, bloating or diarrhea, you have SIBO, most likely. Now, I know some of you have probably said, "Oh, but I have someone told me I have leaky gut." Well, yeah, but SIBO causes leaky gut. You cannot fix your leaky gut, okay? Um, until you fix the overgrowth. I just can't say that enough. Sweet and spicy like that can cause cancer. It's not good, right? Thyroid imbalances is a problem. Okay. Any imbalance. All it is your DNA just kind of go rogue. That's a problem. And I don't care. I'm not even supposed to say the C word. Kimmy, gluten and dairy free, but many symptoms of stomach issues, Hashimoto's, but thyroid levels are fine. Hear that all the time, Kimmy. Look at all this. Look at all this that has to be handled. Okay. And just having a TSH and a T4 just tells you how to manage your hormone. Okay. You just need to get to someone. It is rare. I'll just say it's rare for people if they go gluten free. Okay. Buy them. That's all they do is gluten free. Gluten free is not going to fix your SIBO or your IMO or your leaky gut. It may help you a little bit. If you're having nutrient deficiencies, SIBO's not, gluten free is not going to help it. Yes, you need to be gluten free, but I'm just being real with you. You do have to look at the big picture. You have a complex chronic condition. You have multiple systems that are struggling. Okay. That's why. Why don't I take T3 medication? Most doctors don't like to prescribe it. T3, here's the thing. If you are taking a T3 medication, we know you're number 2, right? You're not converting T4 and T3 because your doctor did check your T3. Your T4 is normal and goes, "Oh, your T3 is low. Let's just give you medication." They didn't determine why, right? Because that's what happens. "Oh, you're not converting 4 into 3. My solution is going to be not mine, but this is what you're told. Well, let's just give you T3." Okay, that's no different than your with the primary hypothyroid. If your car's leaking oil, just adding oil to the car doesn't fix the problem. Okay. What helps SIBO? It's an infection, Kimmy. You got to kill it. Okay. And it has to be done right. And you have to have a SIBO breath test. It's the only way to know. Your stool test won't tell you specifically how to treat SIBO, how long to do it, how long it's going to take, what type of microbials you need, and how to do it. It is a whole process if you have SIBO. It's not as simple as just taking an antibiotic. No. Mrs. Lacey, as a rule of thumb, when should we be getting labs drawn? 18 to 24 months after meds. It kind of depends where you are in the journey. Okay. It really is up to your doctor, but typically what you can expect, and this is for educational purposes, is, if you're first initially put on medication, you're usually going to get a 6-week follow-up to make sure you're good. After that, it kind of depends on how your physician wants to handle the case. Maybe 3 months they'll recheck it, and then every 6 months. But eventually, once you have a stable medication, it's usually yearly. Yeah. But you might have a doctor do something different. Um, NP thyroid, in our clinic, our providers do NP thyroid. Okay. Um, some of you do better on a natural desiccated thyroid medication, NDTs is what they're called, because there's a little bit of T3 in it. That's why. okay? It doesn't fix the problem. Again, you have to find out why you're developing this. Hashimoto's is gonna be part of it. You have extreme symptoms, but doctors won't test more than within range. Yeah, so hopefully you know now, Skep. I don't know how long you've been on our live, but this is why. Because they're only checking you for primary hypothyroidism that only affects 10% of you to get your symptoms to go away. You have to do the additional testing. Conventional, what if you're going to do the conventional model, there's nothing else for you to do there. So keep going back to your doctor over and over and pestering them to pull labs and do this for me. And it's a waste of their time and your time because they're not going to do anything for it. They're not really like really trained on Hashimoto's disease because they don't treat it. So you need to get to someone that actually does do that. Okay. Um, Classy lady, thyroid storm. Yeah, that's when your thyroid just loses its mind and it can be life threatening. Actually, it's something you have to be very careful with. Yeah. Okay. Ash of Spring on NP, my free T3 is always high. Is this the delivery problem? I don't know. I'm not sure exactly what's happening. If you're on NP and your free T3 is high, depends on what your doctor thinks is high. Optimal for T3 is 4.2. Okay. So if you're over 4.2, then you may want to have a discussion with your doctor and say, hey, my free T3 is high. Are you concerned with that? Maybe you're not having the conversion problem. Maybe your problem is the delivery, or maybe it's dealing with the pituitary or the triggers with Hashimoto's. The resolution is more meds. Yeah, that's why my wife was so frustrated. That's why you can get over it. A third of our patients are able to come off their medications and their supplements. Diamond, how do we test for mold? Typically, ours is a urine test for mold. Now, if you have mold, do not ever, and this goes for like heavy metal detoxes or any kind of detoxes. One thing I'll tell you for sure, and thank you guys for watching on YouTube too. But if you have mold or toxins, do not detox those unless you're having adequate bowel movements. Okay. If you're not having daily bowel movements, do not detox. All you're going to do is release that crap and it has nowhere to go. Nowhere to go. Okay. What if meds and supplements interfere with thyroid meds absorption? Yeah, a good rule of thumb when it comes to supplements and your thyroid, okay, is to take your supplements at least 2 hours away from your thyroid medication. That's what we tell all of our clients. Some of those supplements don't interfere with your thyroid medication. Some of them do. How do you know? Like, keep it simple. Look, simple is smart. Smart is simple. Don't try to analyze every single, supplement. Just take all your supplements 2 hours away from your medication. Brenda, you can ask your doctor for different testing, but most of the time they're not, right? You might be able to get a free T3. You might be able to get, possibly your antibodies. But again, what are they going to do with it? That's the problem. And then what are you going to do with it? Like, let's say you do check it and you're not converting 4 into 3. Now what? Now what do you do? Right. But typically, your doctors are going to just do the typical, right? The standard, and that's it. And I don't blame them. I shouldn't make your insurance pay for stuff if your treatment doesn't change. Okay. Woo, SIBO, where'd that go? Okay. SIBO symptoms fit me except weight loss. I'm actually dealing weight gain still possible. Yes, absolutely. Absolutely, Lindsay. I've been diagnosed with H. pylori. Doctor prescribed proton pump inhibitor twice. It's still there. Yeah, because that H. pylori burrows into basically the cells that produce hydrochloric acid in your stomach. The question is, why did you develop the H. pylori to begin with? And you need to get rid of it. Yes, that Gianna, it can affect that. The question is, well, yeah, you've got the prolactinoma. It can, not directly. It's still a pituitary hormone. So autoimmune, that's part of it. 2 to 3 hours is usually what we recommend. Tinnitus is kind of an interesting thing. I wish there were some great solutions to tinnitus. Yeah, I wouldn't say there's a link directly from Hashimoto's to tinnitus, no. Hyperthyroidism, even on medication. I feel awful. I had to quit my job. So sorry. Look out to reach out to us. We help people, a lot of people that have hyperthyroid, like Graves' disease. Okay. All right. Does hypothyroidism cause low ferritin? Ferritin can contribute to your hypothyroidism. It's actually usually the opposite direction. So that's a good great good time to switch over. Let's talk about some nutrients right now, guys. Things to look out for. And then we can go through that. So some of the things that you've probably heard from. Put in the comments, what is the supplements? Just tell me what supplements you're taking right now. Okay. We're probably going to talk about them. But we're going to talk about triggers. And then let's talk about nutrients with the triggers. So Hashimoto's triggers. Triggers. All right, number one, it's going to be gut problems. We just talked about that. That's like SIBO, IMO, leaky gut, low stomach acid, okay, H. pylori. Number two, food sensitivities. You know what I'm going to say. Food sensitivities, gluten, dairy, soy, and processed food. Okay. Do you need a food sensitivity test? I don't think so. We hardly ever do them. We used to do them on every single person we ever did. They're not that accurate. There is some that are better than others, but we don't. There's another way to figure that out. Okay. Next one, gut, food, toxins. Okay. Now this goes for like mold. This can be just environmental toxins. And here are the things when it comes to toxins. You can't totally eliminate them out of your diet. Out of your life. Okay. Now, the thing of that is what's you do want to reduce the actual amount of exposure you're getting. Okay. However, you want to make sure your detox pathways are open. So when you are exposed to it, your body can get it out. Okay. And again, this is a good reason why, like, if you're having these things and you want to do some kind of a detox or something, please don't do that unless you're having normal bowel movements. Even your gallbladder is a key player in this. Your bile is one of the biggest ways that you get rid of toxins in your system is your bile. So you have to make sure you're having at least daily bowel movements. If you're not and you're trying to get rid of the stuff, you're going to make it worse. You're going to make it worse. Okay. Number 4, another big one, blood sugar. Okay, listen. Many of you are partially where you're at because of your blood sugar. It's a key pillar of getting your complex chronic condition corrected. Keep your blood sugar between 85 and 110 all day long. Keep it nice and stable, including the spikes when you're eating. Okay. Highly recommend getting a continuous glucose monitor. Huge. Send me a DM if you want to get one of those. Yeah, you measure your blood sugar every minute. Okay. This is invaluable on what your stress is doing to you, what your work's doing to you, what you're eating. Huge. This is a big one. Most of you, this is like in the top 1 or 2. Okay. So blood sugar is a huge thing. Adrenal. That's your stress hormone. Actually, cortisol. So adrenals are a huge, you have to either not just mental stress, but physical stress. Okay. And then I'm going to cover nutrient deficiencies. Okay. Nutrient deficiencies. All right. Let's cover a couple of these. Okay. All right. Number 1, nutrient deficiency. This is the common things that I see. Vitamin D. Listen, vitamin D is huge. You need to get D3 with K2. Okay. When I go through these nutrients, if you don't know what to get, you can go to the link in my bio. I have our products that we've developed for our patients. Vitamin D. Now, before you go doing high doses of vitamin D, go ahead and get your vitamin D checked in your blood. That will help you understand what your vitamin D level is. Optimal should be 60 to 80 on your blood. Okay, 60 to 80 is optimal. Now, some of you with Hashimoto's may want to be closer to the 60 level. Sometimes you don't want to ramp up your immune system too much, but vitamin D is very important with regulating your immune system. Okay, vitamin D. Okay, D3, K2. Number 2, magnesium. Okay, magnesium is going to be a no-brainer. Okay, a lot of you are deficient in magnesium. Okay. Yeah, vitamin A is important, right? I mean, there is a ratio between your vitamin A and your vitamin D. Some people kind of, you know, put the scale out of balance when it comes to vitamin D and vitamin A. But yeah, throw in the vitamin A. It's not necessary. You don't necessarily have to get vitamin A, and you have to be careful with vitamin A because you can actually get toxic when it comes to vitamin A. So yeah, magnesium. What kind? Okay, depends on what your goals are. If you're looking to get your bowels moving, that's magnesium citrate. For general, magnesium glycinate. If you're looking for brain function, magnesium L-threonate. Okay. Now, out of all of those, what I did is I developed a magnesium that has all of those. In fact, the product that we have, like I said, I'm not here to sell. I'm just giving you options. If you're looking to do something right now, but for brain development, they did all of the research studies. There was one particular type of L-threonate that they literally did spinal taps, and they found that L-threonate crossed the blood-brain barrier with this particular type. That's why in our complex, our magnesium complex, we have multiple different versions because you have multiple reasons why to take it, different types for different things, right? But the one L-threonate is the one they used in clinical studies. This is the one that has been proven to get in through your blood-brain barrier. So that's what we put in those ones. So those are the types of magnesium. Number 3, okay, you're going to get selenium. Okay, now selenium is important. 200 micrograms is your max. I don't recommend Brazil nuts. Okay, don't recommend Brazil nuts because the amount of selenium in each Brazil nut's different. So yeah, you need to watch that. So I recommend getting that in a supplement. Okay. The type of selenium you need to get is selenomethionine. That is the type that you want to get. Selenomethionine. Okay. Selenomethionine. Now, again, we've developed a product for our patients that if they're looking for kind of one kind of general thyroid essential grouping, I actually developed that too. It's thyroid essentials that have a little of all of this that we're talking about. So you don't have to take 15 different supplements. Okay. But if you're going with a specific selenium, selenomethionine. Okay. Selenium has been proven to lower your thyroid peroxidase antibodies. Okay. Now, here's the thing. A lot of people are chasing, okay, chasing your antibodies. You need to be realistic. You're always going to have antibodies, okay, and they're going to fluctuate. All right. And your antibodies don't necessarily determine how you're feeling either or how bad your Hashimoto's is. Okay. That is just a big disservice to people when they're trying to chase it. Yes, it's nice to have lower antibodies. I have patients that have a 2000 antibody and they're feeling amazing. I have someone that has 13. So there's not always correlated that way. Okay. Not always correlated that way. Vitamin D can be toxic, but it's like you got to be over 200 on your blood test for it to be toxic. Now, again, stay between 60 and 80. 60 and 80. Okay. Sweet and spicy. This is a good point. Why are people deficient on vitamin D even living in a sunny state? Well, there's a lot of factors that go into for you to the sun to stimulate your vitamin D synthesis. Okay. One is the UV index has to be over at least 2 or 3. Okay. That changes from day to day. The sun has to be at least 30 degrees, 35 degrees in the sky. Another factor. So there's a lot of factors go into it. If you're interested, is you want to go and get that. If you want to get it from the sun, there's an app. I have nothing to do with them. It's called D-Minder app. Kind of a cool app. I actually use it too. It'll actually, with your GPS, your phone, it'll calculate where you are, and it'll actually tell you when to go get your vitamin D. Okay. And then you can go get, when you do your vitamin D session, you hit play, it'll actually calculate how many IUs of vitamin D you're getting from the sun, estimated. Really cool little app if you're looking for that. But there's a lot of factors into that. That's one of the main factors. Because people are going out, the UV index is 1, getting 0 stimulation. Or they're going out at like 4:30 in the afternoon thinking they're getting stimulation while they're wearing sunscreen. The only UV rays they're getting are the ones that cause, that damage your DNA. Okay. Yeah, so if you're looking Lindsay's asking, "How do I get the lab work done?" And if you wanna do our, root cause consultation. Well, here's how it works, is, we'll email you a lab order. So you go to the link in my bio, you click, you'll pay the 199. You'll book your consultation 5 days after when you're gonna get your blood test. We send you the lab order, you take it to your local LabCorp. You got dozens, okay, probably 5 minutes from your house. You get to draw there. If you're in a super remote area, you're like in the middle of Wyoming and there's nothing around, we can send you a kit that you take to your hospital. Yeah, so it doesn't matter where you are. If you're international watching this, you want to schedule that one, you still schedule, we just don't do the blood test. In fact, we won't let you do that. Just do a discovery call first. Okay. D-Minder app. D-Minder app. Okay. Selenium, selenomethionine. Now, the next one here is going to be glutathione. Glutathione. Glutathione is going to be really important. Okay. Glutathione protects your tissues from damage. What you don't know is when you're making thyroid hormone, there's hydrogen peroxide that's corrosive to your cells, so it damages your cells, that it interacts with your thyroid peroxidase, which your immune system is usually attacking with Hashimoto's disease. So you'll have excess hydrogen peroxide or spillover, and your glutathione is one that cleans it up. So there's just a higher demand on it when you have Hashimoto's disease. So glutathione is one of the things I highly recommend people taking. But the type of glutathione is important. Who in here is actually taking glutathione or heard about taking glutathione? Give me a thumbs up or a yes. That way, if no one's really that interested, I don't have to go through it. But glutathione. So let's talk about some glutathione, the type of glutathione. Okay, glutathione. Number one, there's reduced. Reduced glutathione is the active form, but it cannot get it through your gut. So if you take it orally, you're not going to get it into anything. The goal with glutathione is getting it into your cells. Okay, that's the goal with just about anything you take. But glutathione, reduced glutathione does not make it past the gut. It doesn't survive very long in your bloodstream either. So it's not the best option. Look at your supplement, see if it says reduced glutathione. If it's not liposomal, you're not getting anything in there. Okay. Next one is S-acetyl glutathione. That's the form that you want to get. S-acetyl glutathione. Will survive your gut, it'll survive your bloodstream and get into your cells. Okay. Number 3 is going to be NAC. That's N-acetylcytosine. That's not glutathione, but what that is the precursor, because many cells in your liver makes glutathione. So that just helps drive your own glutathione synthesis in your body. Okay, NAC. All right. NAC. Now, the last thing here I want to talk about is liposomal. Liposomal is not a form, it is a delivery. So it just, what liposomal does, puts this little fat layer around the molecule of glutathione that helps preserve it. So if you're getting liposomal, reduced glutathione that's liposomal, you can get it into the cells. It's just not ideal, but you can get it into the cells. Okay. But the problem with liposomal, anyone in here taking liposomal glutathione in a liquid form? Because it's almost always a liquid form. Okay. Anybody? Put in the comments if you're ever taking reduced glutathione with liposomal. Okay. Here's the problem. Glutathione, it is protective in your body for sure, especially when making thyroid hormone. But my gosh, it is sulfur based and it is nasty. Okay. Oh, I can't handle it. I even think about glutathione. And what happens is many times when you're taking reduced glutathione in a liposomal form, the solution, because it's so nasty, is to mix it with, half a cup of orange juice or some type of grape juice or something like that to help you get it down. Now you're just jacking your blood sugar up. Okay. So that's why the S-acetyl is the best way. Now we have a product that we give our clients that it's all 4 of these. It is S-acetyl. It has some reduced with the NAC and it's liposomal. And it's in a pill. It's in a capsule. So you don't have to drink it liquid. Oh my gosh, it's a lifesaver. So if you don't know what to get, okay, not all supplements are the same. They're about 80% of them are garbage. But yes, S-acetyl is if you're looking for, if you want to save yourself time, you can go to a link in my bio and we've got it. That's just what I do with my clients. Yeah, we do glutathione IVs in our clinic. Yes, usually glutathione IV is going to be reduced glutathione. Now it's going directly into your cells. So think of it like a glutathione IV as a big push all at once. Okay. But it doesn't stay along very well, right? This is why, like, I do a monthly, I try to as much as I can get my monthly glutathione push along with the oral glutathione. That's the idea. Okay. How can I, let's see here. Okay. So that's the glutathione. So now what I'm going to say is these will help you through the process. Now, think of it this way. Let's say you're having blood sugar problems, right? And you're running in a roller coaster ride with your blood sugar. And honestly, your A1C, it tells you know you can use it for diabetes. Regular, I don't care if you're diabetic. It's the roller coaster ride you're going through. Okay. The thing is you can have a lot of highs and a lot of lows in your A1C. It's just a calculated average. So a lot of people, the A1C can be very deceiving, unfortunately, in that particular state. Okay. So that's why if you're doing if you're really looking at your blood sugar, you want to get your insulin, your fasting insulin, you want to get your A1C. It gives you information. You know, you can get your glucose. You can even get a C-peptide. There's a lot of things, but just keep in mind, that's why I like the CGMs. I think every human being should wear a continuous glucose monitor. That way you can see what your life is doing to your blood sugar. If you can keep your blood sugar between 85 and 110 all day long, that alone will solve about 80% of all chronic diseases. Okay. It is a huge thing. And every one of our patients that we put a CGM on, they're shocked on how even healthy foods that are good for them don't do well with them. That's why it's really good. Okay. Okay. Yeah, I can't recommend it. If you're pregnant, just talk to your doctor. That's all you got to do. Yeah, if your A1C is all over the place, we know you're on your roller coaster ride. You got to stabilize that out. And that's one of the things we do. Okay. That's one of the things we do. Um Copper, yeah, there's some good things with copper. It's not something I regularly go into. I don't find that it's a huge thing for most people. How would an A1C be useful? I'm not diabetic at all. Yeah, it's the roller coaster ride. Okay. Again, when you're calculating your A1C, this is like your blood sugar. Okay. This is one, let's say this is 140. This is 0. And you want to stay within this range, 85 to 110. Okay. That's kind of why you want to stay within this range. But what happens, people, right? Is you've got your blood sugar goes like this, whoa, and then it drops, and then it drops, and you're like this all the time. Okay. And you average all of that out. Well, you can get a 5.4 and you're fine. But every time you go up and down, that can stimulate your Hashimoto's disease. And it causes stress to your cells. So yes, that's why I like the CGM with literally, that's the best way to go. Okay, so if you're watching this and you're struggling and you're looking for answers, looking for some help, a couple ways to do it if you want to take the next step with this. Number one, you can go into our bio, right? If you're on TikTok, just click the picture. The next box comes up, click my picture again. You'll be in my bio. And then you click the link there that takes you to our link tree. And then you'll be able to do number one, the discovery call. Number two, that's free. Number two, you can do the root cause consultation. It's $199. That includes the blood test and the hour-long consultation. Okay. Hour-long consultation. Okay. Those are the two things if you're looking to take the next step. If you're not quite there yet, what my session is, go through some of the things we just talked about. Balance your blood sugar. Keep it 85 to 110. Okay. Just do that. That's a huge thing. Make sure your nutrients, go get your vitamin D checked, have them do more testing, right? You can see what your full things are. We went through a whole bunch of stuff with you guys that you literally can take action on today with. Okay. So hopefully you can do that. I hope you guys have a great weekend, and we'll see you on Monday. Okay, it's just you and me here. Great. Thank you for being part of our live, and we'll see you on our next live.